Thank you so much, everyone. It's great to be here, and I am honored to join the group here. And my name is Wei Chao Yuwen. I am an associate professor at the University of Washington Tacoma campus, and we are located in the traditional lands of the Coast Salish people. And today I will share a bit about our projects, COCO, and I will start sharing my screen. And do let me know if you do not see a shared screen of title COCO Health. Okay, oh good. All right, so my understanding is that I'll spend maybe 5 to 7 minutes sharing a brief introduction to COCO, and then I'll stop sharing and we can have a discussion and take any questions or comments and feedback you all have. Okay, all right, so COCO is named for Care for Caregivers Online. So we are a program supporting family caregivers. As we know that there are about 53 million family caregivers in the United States. And among these, a lot of them, about three-fourths of them are among the US workforce. So some of them are taking care of both young children as well as their elderly family members. And a recent report shared that actually the majority of them report wanting more resources on their own kind of caregiving, caregiver related topics, such as managing their own health, which is actually #1 request from them. And if the caregivers do not get sufficient support, there is significant negative health impact, including, for example, they experience high stress, anxiety, and depression levels, which may lead to burnout and affecting the quality of life and work and the inability to provide care for the receivers. On the other hand, I am a nurse by training. In the past 3 years, with our pandemic, I've seen personally of our students that are experiencing severe fatigue and burnout in terms of providing care. And there's a severe shortage in healthcare professionals in general, as well as mental health support. And for our family caregivers, they're the backbones of our healthcare system, but they are not directly in the system in terms of, the insurance usually do not provide support for caregiving activities. They would have to go through their own insurance, health insurance for their own health. So there's a gap there. So in response to these huge gaps, we are developing COCO. So COCO is a tailored support system and delivers empathetic care to our family caregivers. Here that I'm first showing our mobile app for the family caregivers. You can see a screenshot of the front page. COCO has evidence-based resources and features such as daily check-ins and self-care tips, health tracking for the caregivers, and tailored caregiving resources that would send reminders to caregivers. And on the right side here, what you are seeing is the chat interface. So COCO's main feature is delivering evidence-based therapy sessions through a chat screen. And here we're delivering problem-solving therapy. As you can see, I know the ChatGPT OpenAI is all over the news right now. And what you can see here that COCO tries to do maybe differently from the previous chatbots or the ones that you've seen recently is that we're trying to build empathetic care through chatbot. So we know that maybe right now the domain-based, health questioning and answering can be provided by chats, but less is available for really kind of this multi-turn conversation and really delivering empathetic therapeutic conversations. For example, here you can see these are actual conversations with family caregivers. When we ask someone who is very anxious and stressed out how you are doing, sometimes they just let everything out because they've not had the opportunity to do so. So this caregiver shared multiple concerns that they're having. So then COCO would try to understand what the situations are, provide empathetic responses, and then also pick one and ask them to kind of let's focus on one of your concerns first, and then let's do it one by one and direct them through a therapy. And I'm going to move on to, in addition to the mobile app that's on the right side, we also have our nursing platform. The reason that we have this second kind of provider facing platform is that we know AI can't do everything. And the goal is not for the chat or AI to replace the human care, but to make it more efficient and empathetic. So we developed this platform for our nurses to communicate with family caregivers through the COCO AI and through an efficient platform so that they will be able to provide empathetic and efficient care. So they would provide the care better through our platform. And I'm happy to go, back and go to more details on different slides if we have time and folks are interested. I'm going to move on quickly to what we have been doing in our future directions. So currently, we launched in 2019. It's been about 3 years, and COCO has received about 200K grant funding to develop and beta test COCO. Among all the different projects that we've been doing and testing, I wanted to highlight 2 of them. One is that we conducted a therapy session with about 40 family caregivers, and they interacted with COCO for about 10 to 15 minutes to complete one problem-solving therapy session. And even with that 10-minute, it significantly reduced a lot of their negative emotions, such as stress and negative feelings and all of that, and also increased their feeling of serenity. In addition, we also recently completed a pilot testing of our nursing platform, that provider platform that I showed on the left side, and it showed that using the AI enhanced platform had a 30% reduction in the response time that nurses can provide while still maintaining the quality of the care that they do. So that can really enable us to provide a high touch and high value care. What we have so far, we're still a project within UW and we haven't spin out yet. So we're actively looking for opportunities and routes for us to spin out. So we do have our mentors on site in-house. And in addition to that, we have beta testing sites and relationships with different organizations, mostly locally in Washington State. So we've been working with the UW, the HR department to really support our caregivers on campus, both our students and faculty and staff. We have an autism center. Parents of children with autism really need something like this, and we're hoping to collaboratively working with them and really maybe have a version of COCO that's very tailored to this group of caregivers. We're also working with Seattle Children's Hospital, also supporting them. And so far we've done testings and really able to do multiple rounds of usability testing and long-term pilot testing of our mobile app. So we have the MVP ready. In addition, what are the, kind of in the future, what we're working on, we are hoping to, now that we've completed the pilot testing of the nursing platform, we're really hoping to complete the entire ecosystem of COCO and being able to test the entire thing. So hopefully we can find partners that are interested and collaborate with us with that. In addition, we are in the very early stage of kind of research and development phase of developing a multicultural and multilingual version of COCOs that can really deliver services that are tailored towards the very diverse population of our healthcare, the caregivers. We know that marginalized caregivers even are in need of something like COCO even more. So we're hoping to really jump there and address the health inequities there. And this is very short, and I want to just close by saying I can't do it by myself. So we have a huge team. Here are me and Will as the co-founders, and Myra as our manager. And then we have 2 senior scientists on our team to help us. So Trevor is a professor in biomedical informatics, so he helps supports all the natural language processing AI aspects. Teresa Ward is an expert in family and child caregiving, so she supports the caregiving and clinical side of things. And in addition to these, we have roughly about 15 students from different backgrounds working on projects, different projects on COCO. Thank you. And I am going to stop the share, and I would love to chat with you all about this. Jacqueline, you're muted.
Sorry, I tried to click and didn't get there. Well, thank you very much, Waichao. Can we all give her a round of applause? And
Thank you.
so I want to thank you. That's an excellent presentation, a really nice overview. And I always have questions, but I'm going to open it up to the group. Are there any questions in our audience first?
So I do have a question. I love the idea of having this app for family caregivers. How do you enlist the participation of nurses, knowing that nurses, especially through the pandemic, have been really, really burdened, and we have a lot of them dropping out of the workforce?
Thank you, Lisa, for asking that question. As a nursing faculty member, I cannot, emphasize more of this situation that we're having right now. In the current workforce, mainly for COCO right now, it's serving people in the community. So for nurses working in community health settings, a lot of their time are spent, say, responding to family caregivers' questions through, let's say, an e-care platform. And those platforms are not smart, quote unquote, in that. So then they have to type in every response every time. There's not even a template for some of them to help with that. So there's some room for improving that efficiency, and we can see that COCO may have that potential in doing so in the future. Although right now, the nursing platform that we have is for in-house nurses in COCO to support family caregivers, because for family caregivers, their own self-care is slightly different from, let's say, a general mental health app, that their care, their self experience and their health is very closely tied with the care receivers, right? So we need someone to not only have those mental health backgrounds, but also chronic disease management backgrounds. So nurses is kind of in this perfect position to support both the caregiving needs as well as caregiver self-care needs. I hope that answered your question a little bit. And Saban, is that how I say your name?
Siobhan, yes.
Siobhan.
And I don't want to mess up your name, so can you please tell me?
Thank you for asking. It's Waichao.
Waichao. Hi. Okay, so I see that you're working with the University of Washington. They have one of the best social work programs there. My background is in mental health. I am a social work. I've been a social worker forever, and I was a social work officer. And so what I have been actually working on developing with some of the UAA funds, working with their small business programs, is creating a peer support type of program, because women veterans in particular are a group that not only becomes caregivers and that stops them from pursuing their dreams, but also have their own trauma backgrounds from being in the military that aren't addressed. And honestly, when I saw this, I was like, oh my gosh, this may stop me from having to develop a whole new platform. So I'm just, I guess, twofold. One, is there anything that's keeping you from wanting to actively pursue other mental health avenues? And then two, would you be interested in seeing how we could pair this maybe with military, either women or military, because there's a good section of just caregivers of military veterans?
Thank you. And yes, and yes to all of them. But let me try to kind of respond to each one of them. I think the first comment was about social worker. And, if you notice, I kind of probably used the term provider platform versus nursing platform interchangeably. I'm a nurse by training. The default in my comfort area is in nursing. So we started doing it with nursing, right? It doesn't mean healthcare is a teamwork, right? And I have actually had conversations with folks folks in our social worker programs at UW, and in particular, a faculty who does caregivers of older adults in the social worker field. And I think there's always inspiration that in the future we would collaborate and expand it. But currently the pilot program is with nurses. But I would love if if the collaboration works, that we can further all of our kind of trajectories, then that would be great. I definitely welcome that. And the second part is on what you've been working on. And yes, we actually got connected also through our CoMotion mentors about exploring possibilities with the VA. And maybe my understanding is maybe VA is just a small part of the military population. But so what we've learned so far is that the VA has actually a family experience unit, and they really want to support the family caregivers. I am not an expert in, let's say, veterans' experiences, so I would not I would not go to the field and say, let's do COCO with them, but I would love collaborative opportunities to co-develop. I think what our expertise or what we excel is the empathetic care in the technology and kind of the understanding the experience of family caregivers.
Wonderful. Well, as usual, you both made my day, because this is why Health High exists. So I'd love to go to Denise next, please. Denise.
Sure. Thank you, Wei Chow. This is exciting.
Thank you.
And as a nurse of 25 years and other clinicians on here, this is really wonderful. I love the innovation behind it. A couple things came up that I was thinking about. So this is really focused on, you said, this empathetic care for the family. One of the questions I had was, does a nursing platform support like a care plan for a family member? That was one question. And then another one was, a lot of the caregivers, I don't know, I'll assume that what drives some of their stress and their fatigue is not knowing things and needing more information. So I wondered if you could talk about how that platform also provides some basic instructions. And
Yes.
then I have one more, but we'll hold it right there.
Yes, please hold it, because let me address the first one, which is around care plan using the nursing platform. So these are going to be, it's within our kind of roadmap in developing additional features in the future. For example, for people, patients and families going through palliative care, it's very important early on, early palliative care, to engage them and start thinking about them. So those toolkits, we are hoping that those can be added on, let's say, as packages for different conditions and situations. So yes, so let's say if we were to work with you to develop something tailored for families going through the palliative care experience, then that would be a feature that we would prioritize in developing, because that's an integral part. On top of that, I also want to mention, I think maybe related to your second question in terms of, kind of instructions and coaching, a lot of what we see that really actually promoted me or motivated me to develop COCO is we found that caregivers and the families in general will have a lot of questions, and because of the not knowing part. But a lot of the in nature chronic disease and how it progresses is not knowing. We probably won't have the answer that they need, but in the meantime, we can help them to manage the anxiety, the guilt, the stress coming from that not knowing. And that's kind of one of the underlying rationales to develop COCO. But COCO do have we are building in the health question and answering features to make sure, if they have a question or if they forgot, because there's a lot going on, they could forgot things, then COCO will use the very natural way of chatting, If they ask a question, if COCO knows the fact, then we can find the most relevant information for them and respond. And that's also kind of content or condition related. So we're building different packages or databases for different health conditions as we grow. And I want to add on to another aspect that we've been thinking is for some health conditions in particular, communication is very important. So using COCO, we're actually hoping in the future that we can, let's say, coach the family caregivers on what's an effective communication with their loved ones, and how, you know, maybe COCO can do kind of this role play and help them to kind of learn how to communicate better. Skills building is what we would call for that.
Thank you. I would just add that, you know how people get paid for, and I know Lisa and social work, Siobhan, everybody knows that you can get paid to be a caregiver, right? And so it made me think that, is it possible that, you know, people can get assistance from the government or other programs for using COCO, right?
Yes, we've had conversations with DHHS around that, because that's in our state, that's mainly how the caregivers are getting paid. And some of the things that we're talking about is DHHS really wants, like, say, a evidence-based program that has been tested. However, we all know that gap from research to actually implementing it is 17 years. We don't have 17 years to test, right? Like, so those are active conversations with folks, and really making the case that the therapies that COCO delivers and the information COCO delivers is evidence-based. There's strong evidence, but we are using technology to really deliver those interventions and therapies more accessible. And so then making that case that it should be adopted.
Wow, thank you so much. Carla, would you like to go next?
Sure. So thank you very much. I think as a caregiver for my mom that's passed away, you know, I think, and also caregiver for others and parents, it's such, the need is there for sure. You know, I think as I think through implementation, you know, as also as a patient and patient advocate for myself and others, going through the My Chart or corresponding through those systems, and then, you know, is there going to be overlap or integration? Because then to eliminate any duplication, right? Duplication from the nurse care providers, but then also the caregivers. So we'll talk more when we get to meet next month. So I'd be curious to kind of get your thoughts also how you prioritize when you could commercialize this. So when you're going to, you know, whether it's dementia patients or military, anxiety, autism, like, are you prioritizing, and what's your go-to-market kind of monetization thought?
Thank you, Carla, for that question. And that's a hard question for me, because I came from academia, and, you know, thinking about commercialization, finding partners, like, I aren't trained that way. So I'm learning all these, and right now, what our prioritization is, well, so again, probably starting with what I know the most, I came from kind of child and family nursing background. So that has always been, you know, our areas that we've been testing and implementing. And then I also do not want to assume, like, you know, we have expertise, let's say, in palliative care, end of life care, or let's say autism care. So we would collaborate with folks. So my prioritization, or it's more of who is willing and putting it as part of their priority to work with us, because they all, I'm biased, everyone would want to use COCO, all these populations that you mentioned. So it's part of, do we have the right partner to help us move forward? So that's where we are working on right now. And then the second part of kind of go-to-market plan and things like that, we've done quite a few customer discoveries, let's say with DHHS, the government sectors, insurance sectors, and then also recently exploring the employer wellness program, benefit program. Let's see if they are interested in kind of adopting COCO.
Yeah, because I was thinking any pilots that you can get, or even with Highmark or like regional, there's also regional payers where you can have maybe pilots in these areas, and then think about what are the clinical impact that you're making, and also economic impact to the different stakeholders, including the patient first and foremost that's needing the care, the caregiver, and then alleviating the stress on healthcare providers. But great presentation. Thank you.
Thank you so much, Carla.
Thank you. Lisa, you'll be able to ask the last question and then we'll wrap things up.
Okay. I hope you guys can hear me. Yeah, I unmuted. So Alaska has a real severe shortage in direct service providers who support people with intellectual and developmental disabilities. And I know a lot of those folks can qualify for Medicaid services. And I just wanted to comment, this seems like it might be a really good assistive device for primary caregivers for folks that fit within that demographic. And Alaska's really struggling and will continue to struggle because we don't have the workforce to support our brothers and sisters with those kinds of disabilities. So I think this is a fantastic idea, and also for the aging population.
Absolutely, Lisa. We have a student who is a nurse in our clinical informatics program that we are hoping to pilot test with family caregivers of children with developmental disabilities in the very near future, and hoping to, because she has been working in this home health environment for a long time, will be our in-house kind of nurse expert in developing those content and help us test.
Thank you, Waicho, and thank you, Lisa. What a wonderful way to end. So, we are a small group again, but I want to say, the way that we move forward is just the way that Siobhan and Denise and other people have said. Waicho has really told us what she's requesting for Alaskans, it's connections. So what I'd love for you to do is, if you have ideas, Lisa, Denise, Carla, if you want to send those to Waicho, she's put her information in the chat. I want to thank you all. Waicho, thank you so much for coming today. This was just an excellent presentation. It is recorded and I will share that. All of you who want to share it as well, just let me know. It'll be on our YouTube channel. So thank you all for coming again. I'd like to point out that our next Open Innovation is actually on March 9th, and it will be with Denise Hendrickson. So she will be presenting the Alaska End of Life Alliance. So thank you all, and please come back. We'd love to have you again. Thank you, everyone.
Thank you all. Thank you for the opportunity.